12, 2014 Human Services Committee meeting to order. First on the agenda is an approval of it. We have approval and support of the agenda as printed in your board docs packet. Are there any corrections, deletions? Seeing none, a motion to approve.
Aye.
Well, now that we've approved it twice, yes, we're doing well. Public comments. Are there any individuals that would like to address the board in public comment? Seeing none, we'll move on to committee items. The minutes of the April 7th meeting are included in your board doc packet. We have a motion and support to accept those minutes as printed. Any comments, corrections, deletions? All in favor say aye.
Aye.
Motion approved. Medical examiner's report. Dr. Mano?
Good morning. Jill submitted to you electronically, our 10-year analysis, and report. And periodically, we, consolidate all the information and provide it to you. On an annual basis, we also do a report. But this is our 10-year report. And so far for this year, for the last 4.5 months, we have so far had 117 cases, 63 of which we have autopsied. And of those deaths that we have autopsied, so far this year, we've already had 14 accidental deaths. We've had 3 homicides. We have 9 pending that are investigations, 8 suicides, and 7 undeterminables. That's 41 of our 63 autopsies that we have done. The rest of the autopsies are primarily natural deaths, or deaths that get referred to our office from out in the field that either they did not follow up with their physician, we really don't know what's going on, or because of the investigation, there's some components of it that are suspicious. So those are the ones that we work with the the investigating law enforcement agency and the medical examiner's office to provide the actual cause of death. Some of those also include what we call medical misadventures, complications that happen, in the hospital, with complications, from surgery. For our budget for 2013, which we have summarized, we had 112.99% of our revenue, and then our budget, we actually, for a change, came under budget at 97.33%. And the thing that affects frequently our budget is that at the end of the year, we do not pay any of our bills to the vendors, especially for autopsies and that, until we actually receive the autopsies. In December this last year, we had 17 autopsies. Normally, we average 12 to 14 autopsies per month. And what happens is that gets carried over to the next year, so it affects our budget at the end of the year. And at the end of the year, we have at times come back asking for additional funds to cover those expenses. The other thing that I'd like to make the Commission aware of is that we're seeing a surge and an increase in deaths as the baby boomers are getting older. We're having an increased number of deaths, and in 2012 we had 1,549 deaths in the county. And in 2013 we've had our highest, which is 1,682 deaths. And as you look through the rest of the report, we have, tried to break it down based on, age, gender, and what types of accidents and everything. We keep statistics to analyze, all the deaths and the causes of the deaths. if there's any questions, I'll...
Well, first of all, thank you for that detailed report and that breakdown. That was, it was a nice presentation. Commissioners, any comments or questions for Dr. Mino? Commissioner Shotwell?
I want to thank you for handling the incident that we had with the agency, and your office handled it very professionally, and I really appreciate that, Doctor. Thank you very much.
Okay.
All right, seeing no other comments or questions for him, thank you very much.
Thank you.
Medical Care Facility Financial Report. Seeing no one here from their on staff from the Medical Care Facility, in your board packet then you have the January, February, and March financials. Next on the agenda, Lifeways Monthly Report. Mary Beth.
Good morning, Commissioners. In your packet, you'll find this month's report. I do have also some verbal report that I'd like to give, but I have a handout as well, if I could so approach the Commission. That is related to the Healthy Michigan, so when I go over that, that's just a flyer for you as commissioners related to when you're out in the community and maybe you're talking with constituents to have some knowledge about what the eligibility requirements are and how they might be able to access Lifeways to help with the support and applying for that. Okay? In your packet, the discussion related to where we are with activities with the county. One of the things that we're currently doing is having a discussion with the county's facility about being able to provide some support for our safety officer functions as well as lease management functions for both our group homes and for our tenants within the building at Lifeway. So we're in the process of having discussions to see if we can't get the county to provide some support with those. The other thing that's happening is we're in the process of doing our strategic planning that will happen in June. We've sought feedback from stakeholders as related to focus areas for Lifeways as we move forward with our strategic plan. The other thing that we've had happen since I reported last was we had our annual recipient rights audit. And that is an audit that occurs every 3 years to look at your process and within your organization to protect the rights of those that you serve. And with our audit this that happened and finalized last week, we had a 98% compliance. Out of 279 standards, we met 274.5 of those standards. So that was pretty commendable considering all that is required to ensure protection of the rights for people with disabilities. So we're really proud of that and wanted to share that. The other thing that we're finalizing is our financial audit that will be presented to our board this month, and we will be bringing a presentation to the County Commission next month related to the findings from our annual financial audit. So I wanted you to be aware of that. The other thing that's happening is our Walk a Mile rally. I think I talked about that last month and about the fact that that's an important day for community mental health across the state of Michigan to meet up on Capitol Hill. We go with over 100 individuals with disabilities within Jackson and Hillsdale County and providers and family members to advocate on behalf of those with disabilities. And now really is an important time, more important than any other time that we've seen as we talk about the funding cuts related to general fund and the fact that the community mental health is the safety net for the vulnerable in our community. So this is happening actually on Wednesday of this week where we'll be up at the Hill and wanted people to be aware of that. When we talk about the Healthy Michigan, where we're currently at, when I presented last month, it was just the beginning of the changeover to Healthy Michigan and the implementation of the general fund cuts to the community mental health across the state. And Lifeways had experienced a 55% reduction in general fund. I wanted you to be aware of the fact that we've done a lot of things internally as an organization to address those cuts. And We've reduced our state inpatient from an average of 12 individuals a month down to 5 individuals per month, which is a savings about $200,000 on our general fund on a monthly basis. The other thing that we've done is we've gone from 850 individuals who were in January open to services being funded under general fund, now down to 350 individuals. So we've really had to look at and transition those people into community resources. And we're continuing to evaluate the individuals that are currently still open and looking at how might we be able to transition them if they're appropriate, and also assist them with the Healthy Michigan application. As of last Friday, I heard that the number of Healthy Michigan enrollments for Jackson was at 1,600, based on the information that Lifeways has access to. The other important thing, when we look at it from the state perspective, as you might recall, when I was here last month, I talked about the projections being based on 250,000 individuals statewide for the month of April. The state has actually hit 200,000. So we are kind of moving in that direction, and Lifeways has done a lot partnering with key stakeholders to have events in our community where we help with the enrollment, because like I've mentioned before, it is a capitation type payment, risk-based, so you want to get all eligibles in your community enrolled, not just the ones that you serve. And we've done everything from outreach to substance abuse locations and the free clinics in Hillsdale, as well as with Allegiance, the Center for Family Health. We're also looking at partnering with the homeless shelter and the food banks to have staff on site to assist those people with the enrollment. So we're really doing everything we can to be aggressive, which is important as we look at our funding transition. And that's really all that I had for an update. If the commission has any questions.
Thank you. Any comments or questions for Mary Beth? Seeing none, thank you for your report.
All right, thank you very much.
Next on the agenda, Regina, we have Region 2 Area Agency. Yes, it is. Like, okay, so I just said it. So.
They say triple A's.
It is. You need it.
First of all, I'd like to openly apologize for not being here last month. So they've made time for us this month. It was a mistake on the calendar, so here we are. And secondly, I have a couple of handouts I would like to offer.
A motion to receive and support. All in favor say aye. Aye.
Excuse me. Last month, this report was probably in your packet, so most everyone probably went over the what we call the first quarter of funding for services for Region 2. So I won't duplicate that information, other than to say at the bottom of the paper, it said Older Americans Act funding increases will be approved by Region 2 Area Agency on Aging Board of Directors on April 24, 2014. And that amount was approved, by our board, and at our next meeting, we will give those facts, to you, how much there. The best news I want to talk about right now is that the Region 2 Area Agency on Aging Board approved the PACE program, a partnership with United Methodist Retirement Communities and Presbyterian Villages of Michigan and Region 2 to go forward in what we call a PACE program that are coming up all over the state. And the PACE is a program of all-inclusive care for the elderly. So I've handed out information to all of you, so I'm not going to read it all to you, but I would be available for any questions if you have them. We actually have a name for it, Cascade PACE, okay, already, so it's taken on sort of a Jackson name. We're looking for property in Jackson already. The timeline I have put inside your packet, so you'll be able to see how fast this plans on moving. There's been a couple offers on space and buildings in the Jackson area, so that's out there as well. So we're pretty excited about being able to serve the dual eligibles in the 3 counties out of a Jackson site. And this is a program from Michigan Department of Community Health as well. So the dual eligibles would be individuals with nursing facility level of care who have both Medicare and Medicaid. So the PACE program, as you will read in here, later, will serve probably up to 200 people at this day center. It'll have a medical director, a medical facility inside, and the clients will utilize this medical director as their family physician. Okay, our whole goal is going to be to keep them healthy out of the emergency room, out of the hospitals, by overseeing their health needs, during the day as well as their social needs. So I hope that each of you will take an opportunity to read this, and if you have any questions, maybe that you can't answer today, you'll let me know at a later time.
So how far are you in the process of finding a location then?
We've put an offer in, and I shouldn't say we, UMRC has put an offer in, and then a counter offer, and I haven't heard back this week on a counter offer on a site in Jackson.
Okay.
And so, but there's like 3 or 4 different sites available.
Okay.
Needs to be about 20,000 square feet, and the building plan is all designed pretty much the same all over the country, so it's not going to change a whole lot. You can just, we will go in and renovate and change and
Because I
upgrade.
recall original conversations you were talking about near the 127 area highway and Liberty Township specifically.
We originally were looking at Liberty, and you're right, around Liberty 127 area, because that's where the need will come down for the space between the 3 counties. But MDCH, moved that up a little bit, because 51% of the dual eligibles, or more than 50% of the dual eligibles, are from Jackson County, and the majority of those are from the Jackson City.
Okay.
And so that's why we have moved up 127 a little ways, so that we can serve, the majority of the people easier, from that. And MDCH approved that, so.
All right. Commissioners, any other questions for Jenny Broderick? Yeah. Commissioner Rice?
Hi, Jenny.
Hi.
It's not really a question. I just want to make a comment. I just want to say it's certainly a pleasure for me to be on the board of directors with Region 2 AAA. It's easier. It's easier. And in regards to this PACE program, if everything goes the way it should, hopefully, it will end up in the Jackson community.
Yes.
And what's nice about that, and there's nothing against our neighbors that we work with Hillsdale and Lenawee, but what's nice about that, they will utilize local resources, such as our hospital, potentially like other kinds of services, whether it be physical things with physical therapy or whatnot. But again, any kind of healthcare services will for the most part come out of Jackson County, which will be a wonderful thing, including mental health services even. So again, this program, we really would like to see it, at least, well, I'm being biased, I really would like to see it here in Jackson, because it can provide a lot of help to people, but also provide jobs and services, et cetera. So I just wanted to mention that.
Thank you, and I might add to that the contractors, the architects and planners plan on using all local contractors. Our medical services will come out of this area. pharmacy services will come out of this area. It is the goal of United Methodist Retirement Communities, MPVM, to utilize Jackson. That's why we looked for a name, Cascade, that had some, importance to Jackson, and a home name, so.
By chance, any of the locations that you're looking at, are any of them on the bus line, the JETL bus line? Yes.
And the PACE program also offers transportation for the clients.
Okay,
So
that's part of the
yeah,
contract?
so
Okay,
that,
excellent. What other
they are
comments?
on the bus line, so.
Okay, thank you.
Thank you.
What other comments or questions? All right. Well, thank you very much for your Area Agency on Aging report. Now we have Department on Aging, monthly report.
Ginny just mentioned that some funding has increased for grant programs, and that is replacement funds for the government shutdown that happened back in October, and they reduced grants by 18%. So the funding she's talking about is replacing those funds, so that we're at the level where we wrote our grant request for this level of funding. So it's great news that it's been restored. Special event meal suggested donation. With our Older Americans Act funding, we don't charge a fee for our services. We do have suggested donation levels, or cost share is what we refer to it for some of our programs. For our meal program, for the congregate meals at our senior sites, our suggested donation is $2.50 a meal. And suggested donation means just that. You could donate more, you could donate less, but people seem to have it in their mind, oh, I only need to donate $2.50. So the staff who are planning an annual event, a new event for us in September, would like to have a suggested donation range. So it would still be $2.50, but to communicate in the information about the event, the suggested donation range is $2.50 to $5. So in essence, it's still $2.50, but we're giving that suggestion, you could donate more. So we're just doing that for our off-site special event. Just wanted to let you know. Okay. And then the next part I wanted to talk to you about is related to the county strategic plan, and the part called High Performance Organization, that the county employees have attended different training, and each department has their own aspects of HPO. And again, it's tied to the strategic plan, part of the improved work environment, where we provide good services, and we want to involve our participants and our employees to go from good services to better services, is what High Performance Organization, or HPO, is about. And we have an aging leadership team, and there's 8 of us on the team, and all but one has attended the countywide HPO training. And then, so this is the team that we have a leadership philosophy affirmation, that the county has a leadership philosophy, and as Department on Aging employees, we're saying, yes, we affirm that we want to do our job well, we want to have ownership, we want to be involved, we want to work collaboratively. So our first department-wide training was in October, and this is the picture of the staff who attended. And we have kind of 2 areas of programs. We have our active seniors side, which is our new senior nutrition sites, our senior centers, exercise classes, and then our in-home service side, which is our Meals on Wheels, home care, respite, counseling, caregiver support. At the first training, the staff had what we call good to great ideas. This is what we're doing well, how can we do things better? They came up with 4 different focus areas, and so we had employee work groups meet through the year and talk about these different topics. Then at the next training that we had in October 2013, we talked about the accomplishments of those 4 employee work groups. And one work group was increasing public awareness, and through their suggestion, we attended the Women's Expo that was held in the spring, and I think I mentioned that we talked to a lot of different people who are either currently caregivers or potentially caregivers. And transforming our annual event. Another task group was developing resources. About a year ago, I came to the commissioners and asked if we could add additional part-time home care worker positions so we could lower our turnover rate. Working on a Meals on Wheels employee manual. Third group, employee input. How do we get input from our employees? How can we do that better? And then enhancing services. Can we look at unmet needs for some of our homebound clients? How can we better make arrangements? How do we know that we are serving those most in need who don't have other resources? And there's other recommendations that the task group has had, and this picture, it's on our radar. It's not that we're finished yet. It's still there kind of as part of our goals. And then in April, we had another training, department-wide training. And so we're looking at task groups that will start working shortly. Again, service focus, looking at our relevancy in the community, what needs are we working on that aren't being met by another resource? Is there anything that we're doing that someone else is already doing? Do we need to look at that? Service focus, engaging young seniors, baby boomers is what we're referring to. Is their interest different than someone who's 80? It's a different generation. Workforce focus and customer focus, which is kind of loops back to our service focus because our customers are who we're serving. So we have a map. We're still working on the map. We have a plan. Your route can change depending on what happens along the way. And why do we do this? It's because of our older citizens in our county, and you are supporting all this. Your mission is community services as well as health, our nutrition program, so it all ties in together. So I just wanted you to see how, as a department, we're working within all of our employees who are face-to-face with our older adults to do high-performance organization type activities, again, to better provide services for the people that we serve. Any questions?
Excellent. Well, I'll start by saying you have a very youthful-looking aging team.
Okay.
So, wow. What other comments or questions might you have for Marcy? Commissioner Placzek?
Marcy, the great report. What did you call baby boomers again?
Young seniors.
Young seniors. Okay, thanks.
John, you're smiling too much down there on that one. Is it hitting close to home? Thank you. Commissioner Shotwell?
I would like to make the Human Services Committee and the Health Board aware of Marcy's other job, and she's done an excellent job as the policy chair for the Retirement Board this last 3 years, and she's been a direct asset to that and been very helpful. I just want to compliment her on that, and this is usually one of the only opportunities I get to do that, Marcy, and I really thank you for that work.
Okay, thank you. All right, thanks.
Next on the agenda, we have the Health Department monthly report.
Good morning, Commissioners.
Good morning, Richard.
It's good to see all of you. Rather lengthy monthly report in your packet this time, along with quite a few additional attachments, and I'll just touch on the attachments as I kind of go through my report. National Public Health Week was April 7th through the 13th, and we did a lot of social media posting, utilizing information from the American Public Health Association. So those of you who like our Facebook page would have received all that, and I encourage all of you to like our Facebook page. MELF Day at the Capitol was on April 30th. I did attend that particular meeting. It's our Association for Local Public Health Day to interface with our legislators and also to prepare and present information on the county health rankings. So we kind of tie-bar those two things together. I've talked about our county health rankings in a previous meeting, so I don't need to go into detail about that again. But the talking points that our state association utilized as we went from legislator office to legislator office, as well as some, I think, important talking points for Jackson County were shared with our legislators. I think we need to continue to maintain a focus here in Jackson County on tobacco prevention and control. As I've indicated in some of my previous reports, as many as 35% of the city of Jackson population is smoking, and that's quite significantly high above the state average in general. So that's one of the talking points I identified for us in our Jackson County points, and also to ask legislators to consider looking at more of a kind of a standardized approach to funding things like household hazardous waste disposal days. I mean, sometimes we can do it at the local level, sometimes it's difficult as resources get tighter and tighter, and I think there's some ways that we could do that more on a statewide basis. And also, one of the things I think that we're acutely aware of, and we continue to hear a lot about, related to prescription drugs, is just finding a way to make it really easy for people to dispose of excess prescription drugs so that they don't end up in our medicine cabinets, they don't end up as a source of potential theft and overdoses and deaths. So that's what we focused on MELF Day at the Capitol and Talking Points. Not that I want to be in the lower 50th percentile, half of the counties in the state with respect to the county health rankings. On the other hand, we're taking advantage of every opportunity that we have to bring a little bit more resource to the community to raise awareness about where we are at in the rankings. And that's what my county health rankings outreach paragraph is about, is trying to use some money to help organize and create some awareness events within Jackson County to bring more awareness to some of the key things that we need to focus on. We're continuing to work on our recruitment for our Personal and Preventive Health Services Director. It has not been going really well. We received one qualified applicant and one unqualified applicant for the position. We are now working with Joni Johnson and Human Resources to slightly change our posting to a bachelor's in BS in nursing required, but then we would be willing to bring someone on board and have them complete a master's degree within 3 years of employment. So that's kind of where we're focused right now. We think we'll get more applicants that way. We've been moving along with our public health service integration work with Allegiance Health and the community in general. And just wanted to share with you that as a result of our first meeting on April 28th, we did decide to focus in an integrated fashion on lead testing of children and referral and reporting of results. We want to make sure that no child falls through the cracks with respect to being lead tested. And that includes not only those who are high risk in the Medicaid enrollment side of the community, but also all children in an age range that would be recommended for testing, even if they have commercial insurance coverage. So we want to make sure all kids are tested. We are a higher risk community for lead exposure, and I think that was a very good choice to focus on that. We do a lot of testing in the WIC program. Testing is done in private practices as well, but we think we can do a better job of coordinating everything across the spectrum. The assessment of the burden of mental illness report, I've talked about this a number of times in past monthly reports. We did finalize that report, and I just go quickly through the key takeaways, if you will. The report is pretty long, and I'm not going to spend a lot of time on that, but I'd be happy to do more information on it if the board is interested. By the year 2020, depression will be the second leading cause of disability throughout the world, and it will only trail ischemic heart disease. Those are the projections, which is one big part of the reason why we're doing so much focused work on integrating behavioral health into primary care. One of the other key things to recognize is that mental disorders are strongly related to the occurrence, successful treatment, and course of diabetes, cancer, cardiovascular disease, asthma, obesity. So all the chronic diseases are directly related to mental illness, and our ability to treat both of those is influenced by either one, as well as the health risk behaviors that we focus on so much through the Community Action Plan here in the Community for Health, which is physical inactivity, smoking, excessive drinking, and insufficient sleep. So those are all connected together. The estimate that has been identified over and over, and this is true across multiple years when national or state level surveys are done, is that about 26%, or about 1 in 4 people, suffer from a diagnosable mental disorder in a given 12-month period for Americans that are 18 and over. And that continues to be consistent. But although it's widespread, the number of the main burden of illness is concentrated in about 6%, or 1 in 17 people who might have a serious mental illness. But part of the reason that we did this report too was to help the Jackson Health Network understand what the burden is in the community. So as we plan primary care, we plan to integrate behavioral health with community partners, we can understand what it looks like. So among the 46,237 lives that JHN is responsible for from a serious mental illness perspective, it's about 8,839 people. That's about 19%. And for any mental illness, among about the 92,000 covered lives of the Jackson Health Network in a 12-month period, it's about 26%, or about 24,000 people. What we don't know right now is how much care we're currently providing, but those numbers and statistics are available, and that's kind of one of the pieces of the next steps to look at it. I included our quarterly immunization report card, and I can answer any questions you might have about that. I was just scanning it this morning and noticing where we are ranked on a number of different immunizations. You may have picked up that, for instance, for adolescents 13 through 17 years of age, we are at a 19.6% coverage rate, but the reason that that 19.6% rate is where it is because the human papillomavirus vaccine is not required for school entry immunization or required in general. So it influences a lot of the other rates that you see for adolescents. We do twice as good, if you will, as the state on a whole for waivers of immunizations at the school age level and the child care center level, so we're pleased with that. But as you probably noticed in your packet, I included school immunization waiver policy information that's been shared with all the school districts and the healthcare providers. We're going to make sure that we keep that waiver rate as low as possible, so it helps us avoid outbreaks. We've had our share of disease outbreaks in the community the past 30 days. We've had actually 2 noro-like outbreaks and 1 pertussis outbreak, if you will. The potential influenza outbreak they identified at the assisted living facility has been confirmed as norovirus, so that's why we had 2 that we were working last month. But there's not a whole lot we can do about norovirus. There's no vaccine for it. It is highly contagious and easily transmissible within the institutional setting, and vigilance and infection control is really the key to preventing spread of norovirus in those facilities. Pertussis, we'd like to be able to do more with pertussis than what we're doing. It is one of our vaccines that we're a little bit low on, particularly in adolescents. And unfortunately, what we think is happening, even for adolescents who've been vaccinated with a booster dose, is there's a tendency for breakthrough to occur. In other words, the immunity has a tendency to wane over time, and because of that, we identify suspected people within our community-based settings, and they are able to contract the illness. So don't have any real solution for that right now, but we do have policies in place that and recommendations and guidance that we provide to school districts to help them deal with children who are ill. Their exclusion policies are in place, and there's antibiotics available, so we handle it that way every time it comes up. The FDA is proposing to extend authority to additional tobacco products. This is really talking about the electronic stuff, the e-cigarettes. There was a bill introduced in the legislature here within the past month or so that had its first committee meeting, and I think as a result of that hearing and the knowledge that the FDA is moving forward potentially with establishing rules to regulate that particular type of tobacco product, if you will, that bill will probably be set aside for now to see what the FDA does. Excuse me. We're moving forward with our healthy vending options at the health department. We're excited about it. We've done a lot of work and surveys of staff, and we're trying to take some leadership and walk the talk when it comes to healthy food options. You may have seen the media coverage on the teen pregnancy rates within the community. As you can see from my report, we continue on the downward trend, which is the direction that we want to go. I think we're making great progress with all of our community partners in our teen pregnancy prevention initiative and other things that we're doing. It's not unusual to see a periodic spike come back up, but they usually go down as we keep working on this over time. So just wanted to bring that to your attention. Mary Beth mentioned health plan enrollment assistance for the Healthy Michigan Plan. I can confirm her numbers as well. There are some additional events in the planning stage right now for Healthy Michigan Plan enrollment, as well as just in general health insurance coverage assistance that will take place in July. A couple of recruitment updates for you in environmental health and the animal shelter, and we had a very nice equipment donation take place in the animal shelter. a 75-pound capacity commercial dryer. And staff are really excited to have it, and it's working really well. So unless you have some other questions, I think that's my report.
Commissioner Mahoney?
Richard, I saw a report and it talked about the overuse of hand sanitizers and that sort of thing. You know, that's one of the things that help prevent so many kinds of transmissions. You know, what is the balance there that could prevent things like MRSA from being such a killer?
Yeah.
And I know that's caused by a lot of overuse of antibiotics and a lot of things like that, but, you know, there's a lot of deaths that are related to having viruses and bacteria that can't be killed because of those kinds of things, and I just wondered, you know, what your take was on that.
Well, hospital-acquired infections, they call them HAIs, are actually is a national level goal in disease prevention and health promotion from the CDC. There have been a number of projects here in Michigan as well focused on hospital-acquired infections. It is a big problem, and you're absolutely right that the number of different resistant organisms to antibiotics, it continues to increase, and there's a lot of concern about it. There's been a lot of strategic level discussion at the national level about jump-starting research that would create new classes and types of drugs that can get us beyond where we're currently at. But overprescribing to some extent is also responsible for this problem. And in general, you're always going to have some resistance developing because that's what bacteria do. They want to survive too, and they will find a way to create enzymes that allow them to overcome the antibiotics that we're using. So it will be a constant battle. As far as the sanitizers are concerned, yeah, I think there's some concern about that, but there's a lot of different types of sanitizers available on the market, and I would think we'd be able to shift back and forth between those as necessary to keep infection control in place.
Thank you.
You're welcome.
Commissioner Shotwell?
Going to fund prescription drug disposal, you're aware that our Sheriff's Department has been heading up a plan where you can drop off anonymously drugs, legal and illegal, in his office, as well as city police 24/7, and also you can do it at a couple of the other out-county agencies for disposal of prescription drugs.
What I was aware of was one drop-off location at the City of Jackson Police Department. I have not heard what you've described.
Yeah, it's available at the Sheriff's Office. And I was approached by a citizen who's concerned, and I'd like to know where our health department is on the fact that Allegiance closed the Express Care, which did reach out to our underfunded, if you would, healthcare people. And one constituent shared with me the fact that it was $10 in immediate care for her son. It's now $110, and he has a possible strep infection right now, and he can't see his physician till Wednesday, and has no immediate care situation other than going to the emergency room. I thought the idea behind the Express Care option was to reduce emergency care stops and that type of stuff. Have we contacted Allegiance Healthcare to see if there's a way we can get the Express Care reopened?
Well, the Health Department hasn't had any direct contact or conversation with Allegiance about reopening an urgent care center. There is at least one other urgent care center in the community over on Lawrence Avenue. I'm not sure that their hours are necessarily conducive and useful for everybody, but you are correct in that they did close their Express Care unit, and I think it was primarily financial related. I think they were looking at it as a business operation standalone, and it didn't sound to me, based on the information I received, that they were able to make it work.
Is our medical director not employed by Allegiance Healthcare, and couldn't she carry the message from our organization back to them?
She certainly could. We've not had the discussion about decisions by Allegiance Health to close their urgent care center, but we certainly can.
I would think that would be appropriate.
Will do.
Commissioner Duckham?
Good morning. As far as the drop-off locations for unused or medications, prescriptions and all, is it against protocol or the law to return them to a pharmacy?
I don't think it's against the law. I just don't know to what extent the pharmacies necessarily are reaching out to the community to encourage people to bring back unused drugs that they have prescribed and dispensed to them.
I was wondering if we could possibly investigate setting up a chain of stores, whether it be to Myers and Walmart or, CVS or something, and ask them if they could host this.
Sure.
If we get these things off the street, I know several people fairly closely, they'll take anything they can find. And probably used to employ them at one point or another, but if there was a place where people could take it back, and I think it'd be a good service to the community, and I would think as far as a PR move, somebody like a CVS or Walgreens or something would probably jump at the chance for the PR.
Okay.
Thank you.
We'll investigate that too.
Commissioner Mahoney?
Regarding the e-cigarettes,
Yes.
I guess I know people that are using them as a way to try and stop smoking. And I think if teenagers are smokers and they are using it for the same purpose, I would rather see them doing that versus smoking regular tobacco. But on the other hand, I know people that have now become addicted to smoking that way versus real cigarettes. So I know it's just kind of a crazy thing, but it seems like there should be some sort of
Well, nicotine is the addicting drug, whether you're smoking it through a tobacco cigarette or whether you're inhaling it through an e-cigarette, it's still a highly addictive substance. The other issue is that there are better and safer alternatives than using an e-cigarette to stop smoking. The content of the e-cigarette liquids is still being investigated and tested and analyzed, but there are actually some different compounds that are contained within the liquid nicotine products as well on the glycol side, and those aren't helpful for people either. So it's not like it's a completely healthful substance. We know that because it's addictive in nature, first of all, and there are probably other chemical compounds in it, even though they may not be cancer-causing, they can still be health harmful. So I'd recommend that if someone needs assistance with tobacco cessation, they see their primary care provider, they get the counseling that they need, and they use the aids that are available through the prescription system.
Believe it or not, doctors sometimes tell their patients that have cancer. My sister, for instance, they'd rather see her smoking than to use patches or anything else. And that's crazy to me.
Yeah. Well, we have work to do.
Richard, I do have a question also. In regard to the pertussis outbreak that took place in the Hanover-Horton community, I am aware of the procedures that the health department took in conjunction with our local school district, and I'm grateful for the education process that took place. Did the health department or the schools have to require that students who have not been vaccinated be kept home for a period of time? Was that a requirement?
I don't believe we require exclusion because they're not vaccinated. We may require exclusion up to perhaps 48 hours, or maybe it's even 5 days, I don't recall off the top of my head, so that they can take an adequate course of antibiotics.
Okay. But, normally with an outbreak with an individual who has chosen not to be vaccinated, and an outbreak occurs, those individuals are mandated to stay home. That's an understanding the parents sign in the waiver. So that wasn't applicable here in this case then?
That one I'm not sure about, but I can investigate and get back to you and let you know exactly what happened. Most of the time, what we're finding is that the children have had the required number of doses of pertussis in the school setting. But like I said before, because immunity wanes and breakthrough occurs, sometimes we'll still get cases.
Correct. And in this case, my understanding was they were immunized also. Good. All right. If there are no other questions or comments, we thank you for your report.
Thank you.
Next on the agenda from the Health Department. The Household Hazardous Waste Collection Day is set for September of 2014. I believe we are looking for the recommended action to be to authorize up to $25,000 from the Board of Public Works, RRF funds, to be used for the disposal costs associated with the household hazardous waste collection to be conducted again for Jackson County residents in September. Any comments or questions regarding this issue? We have a motion and support. Before we take the vote on that, Richard or Don, is there anything you'd like to offer, additional information regarding this date?
Well, with your approval of this request, we begin to organize our local county-level planning team to start to plan the event, and that's would be our normal next step. Other than that, no.
Commissioner Placzek?
Could you list some of the hazardous waste that people might want to, so that they have a knowledge of what they can bring?
Yeah, well, normally it consists of different kinds of pesticides, solvents, not latex paint, but those kinds of petroleum-based products that frequently accumulate in our homes. It could be spray cans, it could be many of those kinds of materials. Not so sure about the battery side. Don, do you know anything more about what we actually accept?
More than likely the batteries, such as car batteries, that's what you're referring to.
Any type of battery.
Alkaline batteries?
Okay. Probably the small flashlight type of batteries can be a very expensive component because of the weight. The car batteries can be taken to shops that actually sell the batteries. And they are supposed to actually take them back.
Yep.
Oil-based paints, solvents, agricultural-related pesticides, herbicides, things along those lines. No tires. One thing that we are considering...
Doug, can we ask you to step to the podium, please? And as he approaches, for the sake of record, his response to that was small batteries, yes. Large car batteries, no. But go ahead.
Don Hayduck, Environmental Health Division. Car batteries can go back to the manufacturers, the retailer. Small batteries, we will definitely consider that. Oil-based paints, yes. Latex paints, no. Agricultural pesticides, herbicides. One thing we are considering is electronics collection, because we can actually almost break even or maybe actually collect a few $100s because there is some value in that particular waste over and above the cost. So that is being considered. It's not a definite yay or nay at this point, but the planning committee will look at that.
Right. Commissioner Rice?
Just a question in regards to the financials. You have on here that in past events, households were charged $5 fees. With this appropriation here, is that not going to be charged, or is it still going to be charged?
No, we would still charge it.
So you're still going to charge $5 per household?
Right.
Okay, thank you.
Yep. And this is a residential collection, so just to keep that in mind. We will develop a flyer that'll list everything that's possible to be turned in.
Thank you for bringing that up, Commissioner Rice. What other comments or questions might you have regarding that proposal? Again, this motion will go to the full board. We have a motion in support. Before we vote, Commissioner Deckham?
You said you don't collect latex paint. What's the reason on that?
Well, I think it's probably because where we dispose of the household hazardous waste doesn't take latex paint. There are very few ways to get rid of latex paint in the community. I know that there is a gentleman who does offer a latex paint recycling function who's based in Battle Creek. He has come to the community in the past, and what would be nice if we can coordinate with him to have him come so that he's also there to help collect and recycle the latex paint. He does charge something for that.
I had a fellow representing the Boy Scouts of America in my office a couple weeks ago talking to me about trying to coordinate to collect latex paint. It might be a good collection point.
Yeah, why don't you connect him up with us?
And yeah, they ship it, I think it's to Battle Creek, and they remix it and come up with a color, then they give it away to like Habitat for Humanity and the other community organizations that can use it.
Right.
So
we'd like to see it recycled.
To catch that.
Yeah.
It'd be the Boy Scouts of America. I'll try to get you his name. I
Thank
think
you.
I still have it. Thank you.
All right, and we thank you and appreciate the timeliness in this, so that we may inform our townships as well. So we have a motion and support. All in favor say aye. Aye. All opposed? Motion is passed and will be moved on to the full board. Thank you. Yes. So is there a correction in the board docs then? $25,000?
Isn't it?
All right. So I think, thank you for that comment, and I appreciate that information on that dollar amount. We will move it to the full board and take it from there. Thank you. Next on the agenda, the claims from April. We have a motion and support to pay the claims. All in favor say aye. Aye. Opposed? Motion has passed. Other meetings we have in our board doc packet the January Advanced Council Aging minutes. We have DHS board meeting minutes from both January and March of 2014. We have a June reporting schedule. In June, we hope to see or hear from Department on Aging, Health Department, Lifeways, DHS, Medical Care Facility, and the Veterans Report. Next on the agenda, we have public comment. Is there anyone that would like to address the board? Please stand here and give us your name and where you live, please. And you have up to 3 minutes to speak.
My name is, for all issues or just one per issue?
A total of 3 minutes.
For everything?
Yes.
Okay, my name is Ronald Shanklin and I live in Summit Township. First of all, I think that it's appropriate that the commissioners take into consideration a program for volunteers to go out and work on the potholes in the streets. It's just deplorable. And I think if we have some citizen involvement, they can go to the building supply stores and get a bucket of asphalt repair and put them in the holes. And you can get maybe some magic in place, but they have to do it the right way. And there would be articles in the newspaper to do this. But anyways, I think it's important because it's bad for the cars and also the libel issues facing the county, because if you go into one of these potholes and you ruin the frame of the car, guess who has to pay the bill? Maybe the government. So I think you ought to try to do something. And another issue is, now this is one that this was the birth of the Republican Party, so maybe this is appropriate for this thing to be honored and worked on here, is that seasonal people cannot vote only in the state where they reside, but we become so flexible across the country, all kinds of comparisons can be made, but if you own property in a certain area, you should be able to vote in that area on certain issues. And with a computer the way it is, you should be able to control things. So I think here in Jackson it would be appropriate to find a way to allow people, seasonal people, to vote if they own property in the township on issues that relate to the property, just to the property, nothing else, because it would get out of hand. But there's no reason why with the computers you can do that, you couldn't do this. So I'd like to ask for a committee to be established here in Jackson County, because it's where the Republican Party was born, about allowing seasonal people to have the right to vote if they own property in Jackson County, residential property. So I think you could have, maybe Mr. Shotwell would be appropriate to do this. He's a cousin of mine, a long-lost cousin, and also Mrs. Leitner over here, so I have two long-shirted cousins here in the board. I'd have to really dig to prove this, but I think it's there. So anyways, that's it, and thank you for the time.
Thank you. And Mr. Brown, do you have contact information as well? Thank you. Thank you. Is there any other public comment? Seeing none, is there any committee member comment? Seeing none? Yes, Commissioner Mahoney?
I just don't want the authority of this committee or board to be diminished when we have the authority to support something that specifically relates to the health board, I think the health board should deal with it, like the Household Hazardous Waste Day. We've done that for years and years in the past, and I don't think the authority of the health board should be diminished by trying to take care of this by forwarding on to the full board. The board has given this committee that authority and has set those parameters, and I just think that we should utilize that we have. Thank you.
Any other comments? All right, we'll adjourn to the call of the chair.